Hello, Namaste. I welcome you all to this live stream. This session is brought to you by Easy Ayurveda Hospital. I am Dr. Janardhana V. Hebbar. I am the founder of EasyAyurveda.com and Easy Ayurveda Hospital. I dedicate this and all of my works at the holy feet of Dr. A. Chandrasekhar Udupa. So, this is the first of the live streams that we are doing, and we intend to continue this live stream once every week, preferably from 6:30 to 7 p.m. Indian Standard Time. And so, in this session, I wanted to talk about the like how the cholesterol builds up in our blood pipes. So in this, so I just published the same information in our newsletter that I wanted to talk about. Just give me a moment. So the question that I had received was that why does cholesterol accumulate in blood pipes and cause heart attack or stroke, etc. First, let's define what is heart attack or a stroke. The heart attack or a stroke is caused when there is a blockage of blood pipes supplying to the heart or the brain. So, blood pipes are supplying to the heart or to the brain. If there is a blockage in it, it causes heart attack. Why? Because once the supply is blocked, that part of the heart or that part of the brain which is supposed to receive all the blood, oxygen and the nutrition through the blood pipes, so that is getting blocked. So once that gets blocked, it becomes difficult for the blood pipes to function properly. So once the oxygen nutrients are blocked, it leads to failure of the heart or failure of the brain. So if it is failure of the heart, it is called as a heart attack, and if it is failure of the brain, it's called as a stroke. So this picture explains how the general progression of the what we call as atherosclerosis happens. Atherosclerosis in simple language means that the blood pipes, which is normal here in the scene number 1, as you can see, it is very normal and hale and healthy in the first slide. I think there is some problem with just 1 second. I hope you can see the screen with the blood pipe and other information. Just 1 minute. Okay, so in the first picture number 1 here, we can see that the blood pipe is hale and healthy and there are no damages to the walls of it. In the second stage, in the screen number 2, you can see clearly here that there is some amount of damage happening to the blood pipes. And you can see the yellow thing here. It clearly shows that some amount of cholesterol is getting deposited. In the third stage, that is further improving and increasing the cholesterol deposits, and as it goes further, the lumen or the pipe width starts decreasing, and as you can see in the fourth slide, it is almost blocked. This blockage is what the cardiologists say, that it is 30% block, 40% block, 90% block, so on and so forth. So this is the whole procedure of the blood pipes getting blocked. And in the so in our this one, there are two types of cholesterol. One is called as good cholesterol, and second one is called as bad cholesterol. So the cholesterol do not per se directly go and start blocking. Say if you take the example of a pipe and clogging by, say say cement, or clogging of the water pipe by cement or dust or waste material, etc. So in this case in this case, there is no damage to the water pipe, but the cement or the waste material keeps on accumulating in the pipes, and eventually it leads to blockage. But in the case of this bad cholesterol, so it does not by itself block the pipes directly. First, for the LDL, this bad cholesterol to block the pipes, it has to enter into the wall of the pipes. So here, when the deposits are building, it not only is affecting the blood pipe opening or blood pipe lumen or the inner blood pipe width, it also enters into the wall of the blood pipes or arteries. So that's where this cholesterol deposition becomes dangerous. So naturally, if the cholesterol is slightly high, if the bad cholesterol is slightly high, and if it is circulating, so bad cholesterol or LDL, if it is slightly high and if it is circulating, then there is no it's not a very big problem. But if the LDL or bad cholesterol starts increasing, then the increased density of the blood with the LDL or bad cholesterol, it starts putting pressure on the inner side of the walls of the arteries or blood pipes. So here, inner side of the walls or the arteries start getting affected. This is where the problem starts. Then due to the pressure of the LDL cholesterol, the inner wall gets damaged or wounded. Then, so once there is a damage or a wound, then the circulating LDL or bad cholesterol starts going there and starts depositing. So it deposits there, or it makes a it sticks to the wall and starts building up, as you can see here in this picture again, in the second stage how it is showing. So that phenomena starts happening. So once there is a build up, once it starts building up, then so now the LDL or bad cholesterol has entered into the walls of the blood pipes. So once it is there, it is it starts decreasing the quality of the blood pipes. Then there is a damage to the blood pipes, and whenever it is like uh, a causing a wound or causing a damage or a breaking of the blood pipes, and whenever there is damage, there is always an inflammatory response. So inflammatory response means that there is redness, the blood pipe becomes weak, and and due to this there is suddenly inflammation happening. And whenever, usually when there is inflammation, our body immunity starts responding. So when the body immunity starts responding, it sends it sends immunity cells which can swallow the incoming threats. For example, if there is virus or bacteria, these our immunity cells can go and swallow this virus and bacteria. That's how they kill the bacteria. So in this case of a bad cholesterol, because there is a immunity response, there is a fight between our cholesterol deposits in the wall and our immunity cells. So in that, ultimately the immunity cells win, and these immunity cells will swallow the bad cholesterol. So as this process happens, the cells with swallowed cholesterol starts building a layer of cholesterol, uh, layer of cholesterol on the blood pipes. So it is called as foam cells, or formation of foam cells. So this further causes formation of foam, what is called as foam cells, and this further causes a streak of fat. So streak of fat over the inner layer of the blood pipes, and eventually develops into plaques with thick deposits of cholesterol, calcium and fibrous tissue. So when this whole thing happens, then actually the cholesterol builds up. So this is the whole procedure of building up of cholesterol. And if you have any doubts in it, you can ask your questions in the chat box. I'll be happy to answer them. And going further, so there are many ways in which the many reasons through which the cholesterol, this whole process of damage and inflammation can happen. So reasons for cholesterol build up in the blood pipes or blood vessels. First is a very high cholesterol for a very long period of time uh, in blood circulation leads to, and this leads to increase in the risk of damage to the arteries. This we saw. Next is hypertension. So when a person has high blood pressure, the blood is flowing through the pipes with great pressure. So if it is not controlled and blood pressure is going very high, let's say normal blood pressure is considered as 120 by 80 mm of Hg, but if it is going too high, then it puts a lot of pressure on the inner side of the blood pipes, then it causes a damage, and then again the LDL cholesterol or the bad cholesterol sits on the blood pipe walls, and this problem further continues. So that is also a challenge. Next, here just the physical pressure of the blood pipes is causing a damage to the walls of the blood pipes. Next is smoking. Smoking releases a lot of oxidative stress causing chemicals, and that gets released into the blood pipes. And with smoking, two main organs are damaged. One is of course the lungs, because of smoking, it directly affects the lungs. There is a smoker's cough and many other things happening. And another important organ that the smoking hurts is the blood pipes or blood vessels. So it damages the inner walls of the arteries very efficiently, and then again from there LDL or bad cholesterol gets deposited, and the pathology again continues. Next is artery swelling. So for some reason, if there is injury or any infection, or for some reason if there is any artery swelling, that also causes a damage to walls of the blood pipe. Once there is damage, then naturally if the bad cholesterol is high, it starts getting deposited there without much provocation. Then and then again there is this hypertension we discussed. Next is diabetes. Diabetes also has a very negative effect over the health of the arteries. They damage the blood circulation, they damage the blood pipes, wherein, and also the wound healing is greatly delayed in case of whenever there is diabetes. So this further once there is damage to the blood pipes because of the high blood sugar levels, the healing of the damage or the wound caused in the blood pipes is greatly delayed. That delay further causes a lot of problems, and then that delay gives time to bad cholesterol to get deposited in these blood pipes, in the walls of the blood pipes. Once that is there, then naturally the foam formation and the white blood cell attack, the immunity cells attacking everything that I explained will start happening more rapidly. And then there is something called as free radicals, which also again causes the damage to the walls of the blood pipe. So these free radicals are caused by a chemical process called as oxidative stress. You might have heard the term called as antioxidants. So, if there is too much of oxidants in our body, then it is not so very good for the health. It causes a condition called as oxidative stress. In the oxidative stress, it can be caused due to pollution, heavy metal toxicity, radiation, as in like nuclear radiation or excessive radiotherapy, smoking, alcohol, excessive sugar consumption, even with sedentary lifestyle habits that we say, like our fathers and forefathers who were always active. We are not even 10% as active as them, so they were always out there working in the farms, in the fields, or hunting and gathering and all those things. So for example, my mother, she used to like climb coconut trees to pluck coconuts from the coconut trees. I cannot even climb, or I cannot even climb, say, 2 feet tall plant, for example. So, so we are becoming softer, softer in our minds, and softer in our physical strength as well, which is a not so very good thing. So that again causes sitting for a long time, etc., causes damage to the blood vessels, and again that oxidative stress starts building up. Even the mental stress also is can cause damage to the blood vessels. Uh, as per Ayurveda, blood is called as blood tissue is called as rakta dhatu, and this rakta dhatu is controlled by pitta dosha, and the same pitta dosha controls our amount of courage, our amount of emotions, our levels of intellect and intelligence, and our energy, enthusiasm, everything is controlled by pitta dosha. So blood blood vessels, rakta dhatu and pitta dosha, these are interconnected with many of the mental activities. So this is very clearly explained. For example, there are varieties of pitta. In that, there is sadhaka pitta, which helps us to like aspire to achieve higher goals. Energy, mental energy and enthusiasm is controlled by sadhaka pitta. And then there is another one called as buddhi vaisheshika alochaka pitta. So there is buddhi vaisheshika alochaka pitta, which controls our intellect and intelligence. So suffice to say that the pitta and mind are connected. So this is pitta, mind and blood vessel connection. So we have learnt that pitta and mind are connected, and then mind and blood vessels are also connected. So like I have, so my friend is also my friend. So this is that kind of a relationship. So now the mind, mental health, our amount of stress levels, and the health of the blood vessels, all these are interconnected. And if there is increased, not only the oxidative stress that we discussed here, even the mental stress also, psychological stress also adversely affects the blood vessels. So these are the different causes that cause direct damage to the blood vessels, and so I want to stop here, and then I want to take up some questions. If you have any questions, there is this on the right side of your screen, and there is this question box. Please feel free to ask those questions here. And I think my face is not getting shown in this stream. Anyway, this is our first attempt to the stream. We will improve all the features and make this work better the next time. Please mark the your calendar every Tuesday, 6:30 to 7 for half an hour. Let's meet and discuss interesting things. So the question that we have got here is, how bad does GAD, that is general anxiety disorder, GAD means general anxiety disorder. IAD is an interesting one. It's like a illness anxiety disorder. And then OCD, obsessive compulsive disorder. Probably more people know this OCD and GAD, but let me explain everything. Can significantly, how does it in fact affect the heart and the blood vessels? So so first we have to understand the anxiety. So anxiety is like hyper worrisome mind, where mind is totally occupied with a fearful thought. And if it is general anxiety disorder, these thoughts are, so okay, when we have an exam, for example, then there is exam anxiety. I'm going to attend an interview, then I will have, so there is this temporary anxieties. For example, interview anxiety. So I have to go and get an interview and take an interview, and then my job, my life is dependent. There is this interview anxiety, which is normal. Similarly, exam anxiety also is quite normal. But if that is continuing excessively throughout the day, like always feeling worrisome and lack of confidence, etc., then over a period of time it starts affecting vata and pitta doshas. So it starts imbalancing the vata and pitta doshas. So that's why, just to give one example for this, is say, if people who are worried all the time, they often have gastritis, is a common word, or a hyper acidity, or pitta aggravation, we say. In them they have heartburn, etc. symptoms, which suggest towards pitta aggravation. And in the same people, there is also a diarrhea type of symptoms, and they cannot sit at one place. They wander here and there. They will have cold sweats again and again. Then sometimes they will have excessive or irrelevant talks. All these are vata aggravation symptoms. So So even the so this is these are purely digestive symptoms, digestive system symptoms. So these are getting manifested due to pitta and vata aggravation, and that is purely caused not due to any like wrong diet or wrong physical activity. It's purely caused due to the mental anxiety. So this mental anxiety in this example is affecting the digestive system, and the same mental anxiety can also affect the blood vessels. Why? We already learnt, because the mind and pitta, many factors of the mind such as courage, intelligence, etc. are controlled by pitta dosha, and pitta dosha are connected, and which is again connected to blood, heart and blood vessels. So this is the reason why uh, all the general anxiety disorder can cause blood and heart damages. Next is illness anxiety disorder. Is an interesting disease. In this, uh, in this, like constant visualization of something leads to actual materialization. Okay, I wrote it correctly. So if you are thinking about something, we become that thing. So illness anxiety disorder is that, oh, just because I have a little bit of headache, I start worrying about I start worrying about I might have migraine, or it can be brain cancer, or a brain tumor might be there, or I'm going to die soon, all those things. This can happen. So, so, so similarly, like is also nothing but excessive worrisome, often un, unreasonable, excessive worrisomeness, and that can again cause pitta and vata imbalance, and that again can cause damage to the blood vessels, either directly or usually pitta and vata imbalance can in the blood pipes can also cause, say, hypertension as well. So high blood pressure is a byproduct of increased vata and pitta doshas in the blood vessels. That also leads to damage to the blood vessels, and as soon as there is damage, the opportunistic bad cholesterols can enter inside the wall of the blood vessels, and that leads to further damage, and that we just talked about. So OCD is also this one. People with OCD are often highly anxious. Probably we'll take a class we'll take a session on the anxiety only sometime in the maybe next week, so that we have continued discussion. Okay. Next is so there's a question here. Hi, I'm suffering from endometriosis and adenomyosis with fibroids and cysts. I'm trying to conceive since last 3 years with no success. I'm sorry to hear that. Started naturopathy now, and with hydrotherapy and natural diet without preservatives. I've changed the diet now. Stopped milk and dairy products. This is a good thing to do. I have had 2 failed IVFs in the last 2. It's very unfortunate. I'm very sorry for that. So, with the Ayurvedic treatment, the endometriosis can be very well managed. adenomyosis is slightly difficult to manage, honestly. Uh, so that requires intensive treatments and little bit of a difficult condition to manage just with Ayurveda, uh, to tell the truth. But uh, the chances of the cysts and fibroids are relatively manageable with Ayurveda, but it also depends on the size of the cysts and fibroids and that you have. So, for example, polycystic ovarian disease uh, uh, is quite very well managed with Ayurveda. So, coming to the adenomyosis, in this, the tissue that normally lines the inside of the uterus grows into the muscular wall. So, it is kind of atherosclerosis but happening in the uterus. So it requires a little bit of intensive treatment. It's a good thing that you have started with naturopathy and eating healthy and all. It's the first step. As per Ayurveda, Panchkarma therapy will be required, and oral medicines are also required. And with that, we can increase the chances of success of IVF or natural pregnancy as well. It also depends on your age, height, weight, any other problems such as thyroid imbalance disorders like hypothyroidism, hyperthyroidism, etc. So uh, it requires detailed evaluation and this one. Overall, at least it's safe to say that with Ayurvedic intervention, the chances of pregnancy will increase definitely, and the ovulation and cysts and fibroids and the health of the egg can be very well improved. So to consult me online, please go to easyayurveda.com/contact details. I will post the link in the comment section below, and so you can click there and or copy paste there and go and this one. So this is just the beginning of it. I'm sorry if there was any streaming wise any mistakes, but I'm very much sure to continue this every Tuesday from 6:30 to 7, half an hour. Let's take up one topic and discuss. If you have any questions, then I will definitely answer them. Still, this video will be live in the YouTube. So if you have any questions, please ask in the comment section. I will take them up, and that will become the topic for the next week. So I'll have 1 week to prepare proper answer with all the Ayurveda references and all. Many home remedies, many lifestyle tips, everything coming your way. And if you want to enjoy authentic Ayurvedic Panchakarma treatment, please visit Easy Ayurveda Hospital. It's there in Mangalore. I run it, and I not only I myself, like this big team of doctors and other things. So that can be really helpful. So we are in Mangalore, Karnataka. See you there at Easy Ayurveda Hospital. So next time I will make it more interesting. Please ask more questions. Thank you. Going through some last minute questions. It is very good information by Dr. Sahib regarding Ayurveda, which is very useful to the society. Thank you so much, sir. Thanks a lot. Thanks a lot. So see you next week, next Tuesday. Namaste. Whoa.